Hi everyone, hope you're all doing well today. Just wanted to go over a few items from our classroom last week, from this week, and then also our quiz. Hope everyone, I'm seeing reports of nasty weather up there, so I hope that everyone is staying safe and warm and off the roads. I know that there's one thing I always disliked about Pittsburgh. It was the fact that they didn't take care of the roads very well. So, and just I think because I lived in New York, which was the land of snow, I was used to, an hour after the snow fell, the roads being clear, and that's not always the case in Pittsburgh, especially on the side roads. So just be careful and make sure that you're, not out driving around in this yucky weather. Week 5 last week, obviously, we had a couple of different ethical dilemmas. We looked over the Shivo story, the Parker Jensen story, and just generally, I think what the gist of last week was, among a few different things with regard to the law surrounding these issues, but generally, I think we were really looking at the right to patient autonomy, and then on top of that, how does family play into this? And so obviously Terry Schiavo, she couldn't make her own decisions because of her condition. And then, so who is the one that has the responsibility? The husband who lived with her, who knew, her most recent discussions about those topics. Not that we typically sit around talking about those things, but especially in a situation where, even for an example, my father-in-law recently passed away late last year, and my husband and I are, we don't consider ourselves old. We're middle-aged and worrying about what's going to happen to us. At the end of life is the last thing we want to think about. But both of us also working in healthcare, it's really important to make those decisions and to make it known to your family and your spouse or your partner, or even just your friends if you're not married and not attached in some way. So, it's really important to do that. And I think that this was an example of the husband felt that he knew what her updated views on that were, and the parents were, emotional and also relying on what her thoughts were perhaps when she was younger. I know that my thoughts on it have changed several times over years, and I think most people's change, especially as they age and they see other people going through situations. It's kind of really to get you to think about that, to think about situations where parents get involved in care decisions for their family members or for their children, when it's not a positive situation, where it's perhaps a religious, a religious decision that is withholding care from a child, and otherwise the child would live. By withholding it, the child will not live. Those types of things. And there's not really right or wrong answers to any of these outside of the legalities associated. There's not right or wrong answers. It's really just about your thoughts, and then for our assignments, that is. But then once we get to the real world, and as a healthcare administrator thinking about these topics, you need to think without bias, and you need to think with legal help. Most hospitals have in-house counsel, meaning that they have a lawyer that works for the facility, or if it's a small facility, doesn't have in-house counsel, they definitely have contracted counsel. So there's always going to be a legal mind to bounce these things off of, to make sure that your organization is well within the, the letter of the law. And then from there, it's working with things like ethics committees and whatnot to really make the right decisions for our patients. So that's really what last week was about. This week to come, week 6, we're going to jump into some compliance related laws. So we've already talked a little bit about compliance. I think maybe the week 2 kind of touched on it, and you've talked about it in prior classes. But so this week we're really going to focus on the different types of laws that compliance folks deal with. So fraud and abuse, False Claims Act, Stark, anti-kickback, lots of different areas of the law that are really important in that regard. We have a couple videos. They're a little dry. They're government training, so it's they're a little bit dry, but they're not terribly long, and I think that they can give you a good it's meant to be training for providers. So I think it'll give you a good view, not all in legalese, directed at someone that is not a legal, is not a paralegal or an attorney, to give you some ideas on those rules. We have our discussion this week about fraud and abuse. We have an infographic this week. I don't think we've done an infographic in this class yet, but choose one of your whatever your favorite. I'm sure by now you probably have a favorite infographic software. Easily Venngage, Pictochart. If you use Pages, that's fine. But don't pay for any of the systems. There's a free way to get those to me, either with a low quality download of the picture or by sharing it to a central repository on their site, and you can give me the link. There's a few different ways. If you have issues with it, let me know, and I can help you. But you're going to create an infographic. Infographic is a one-page pictorial representation of info. I say one page because I know that there's a faculty member in our program that does multi-page infographics, and really an infographic is meant to be a single page for the purposes that we're using it. She does something completely different with it, but an infographic is a one-page pictorial representation. So please keep your infographic to one page. It can be a big page. Some people do the ones that are thin and really tall, and that's fine. I'm not going to print them out, so it's not an issue, but it should just be a single page. Also make sure in your infographic that you are putting your references at the bottom. You don't need to cite them throughout the material because it's not an APA formatted document. But if you're using information from an external source, please make sure you cite that. And then we have our quiz and our summary, our Edpuzzle for this week. So let's take a look at present. There we go. Let's take a look at the quiz questions from this past week. So first one, the blank strives to provide viable alternatives that will lead to the optimal resolution of many difficult dilemmas facing patients, including end-of-life issues. So like we were just talking about, I was talking about Shivo and some of the other cases, the ethics committee can really help you in this regard to make sure that you have knowledgeable, trained folks from the legal perspective, but also from an ethical perspective. Sometimes it's difficult for, especially those that are like hands-on in the situation, like physicians that are treating patients, nurses that are treating patients, and even sometimes the administrator, depending on how involved they've been. It's hard to remain unbiased in these situations. And the ethics committee, they'll always have an ethicist on board, and ethicists are typically folks with a PhD in ethics. So they're very knowledgeable about all the different theories, and there's the attorney will always sit on the ethics committee as well. So I used to be on an ethics committee. It's heart-wrenching. There's horrible decisions that group has to make, but there are also times when you can be really helpful to a family and put them at peace with their decisions. So ethics committee is our answer here. Next question. When applying the objective standard of informed consent, and then lots of different things here. So we're thinking about informed consent, and when we're applying the objective standard. So think about the objective standard is really, what would this person, what would the normal reaction of this person have been based on their background. So our answer here is one must take into account the characteristics of the plaintiff, including idiosyncrasies, fears, age, medical condition, and religious beliefs. So informed consent is not cut and dry. Informed consent needs to be altered or tasked to your specific situation. So think about the patient to get stem cell treatment. So as we talked about with the stem cell issue, informed consent, as we talked about in that assignment, informed consent for something like stem cell treatments or any clinical trial, research-based treatment, especially early on in clinical trials, is that you need to truly be able to provide informed consent. It's not just about getting a paper signed. It's about making sure that that person understands the need for the consent, understands the risks and benefits, and is willing to proceed given typically a high-risk situation. Based on their age, based on their medical condition, they may not be able to understand some of these things. So it's not as cut and dry as it would be with, say, signing a paper to say that you understand what the HIPAA rules are. This is a much higher level, so just be aware of that. Next question. Although hospitals are not generally responsible for informing patients as to risk benefits alternatives, hospitals blank. Lots of different answers there, but our correct is in some cases owe a duty to provide patients with informed consent. So if in a situation where typically, say if you're going to a hospital to have surgery, the surgeon will be doing your informed consent because they're the ones that understand the risks and benefits, etc. If you're having anesthesia for surgery, the anesthesiologist will come and do that with you. But if you are coming to a facility perhaps to have an MRI or to have some kind of nuclear medicine treatment, in those cases, the hospital may be responsible for obtaining that informed consent because there are risks associated with those procedures, and you'll need to sign off on that and be able to ask questions of the radiologist, likely if they're in-house, or at least the technicians, various different types of folks that are involved in performing these types of tests. Could be a nuclear medicine technician, could be a rad tech, could be a CT or MR tech, whatever it happens to be. But the folks that are trained and licensed or certified and can provide you with that information. So sometimes hospitals do have to provide informed consent on their own. So that's all I have. As always, if you have any questions, please let me know. But otherwise, I will look forward to seeing everyone in the class this week. Thanks.